And now, after a small prayer, we move on to the welcome address. And I welcome the President of IPGA, the General Secretary of IPGA, all the members of IPGA, along with the invited expert panelists of this day, Lokendra Sharma sir, who joined earlier in this meeting, who is the Senior Professor of Pharmacology in SMS Medical College. He is in charge of the National Pharmacovigilance Program of India also. And Dr. Monica Jain. Dr. Dheeraj Kaul is expected from US. He is also going to join us. He is a very inspiring speaker, talking about many things for the pharmacists in the last meeting that we have conducted in the last year. And with these three panelists, we have among us all the office bearers of IPGA from Central Rajasthan State and our local chapter, along with teachers and students. Welcome all of you. And we would like to hear from the president of our Indian Pharmacy Graduates Association for some time. Please, I welcome here our president and secretary to address the gathering, and we'll move on to the next. Please, sir. I think yes. Hello, sir. No, sir. No, sir. That's what I'm searching for. Is there any mistake? Yes, yes, sir. Yes, sir.
One minute. Now it is coming. Hello.
Yes, sir. We are hearing you. Sir, we are hearing you now.
Is it okay now?
Yes, sir.
Maybe due to some this earphone, some problem may be there.
Yes.
So, I'm sorry, there was some technical problem. So good morning, everyone. I welcome to this webinar Dr. V.K. Agarwal, the President, Dr. Manju Agarwal, the Executive Director, Engineer Deep Kamal Agarwal, the Director of Alwar Pharmacy College, the panelist of the day, Dr. Lokendra Sharma, the Senior Professor of Pharmacology, SMS Medical College, Dr. Monica Jain, Senior Professor of Pharmacology, SMS Medical College. The other speaker to join, Dr. Dheeraj Kaul from USA. Members of IPGA, Shri Ajay Pathak ji, Shri Rajesh Yadav ji, Dr. Jaya Balan, the students, faculty members, and all professionals. Good morning to all of you. Now, this is the right time when the entire world is facing this pandemic of COVID. We are in the third wave. We have seen the first wave, we have seen the second wave, we have seen the third wave now. But during this pandemic, what we have observed that pharmaceutical industry, whatever recession may be, is working very hard, and each and every professional in the field of pharmacy, whether he's working in research and development section, in quality control section, in quality assurance department, in manufacturing, in hospital pharmacy, in community pharmacy, in clinical pharmacy, in regulations, in marketing, everybody is working very hard. And they are trying to see that there should be availability of life-saving drugs, including COVID management drugs, to all the consumers. Myself, Dr. Atul Nasa, working and heading Drug Control Department, Government of Delhi, we are also trying our level best to see that each and every consumer, each and every member in the country should get all vaccines, should get all life-saving drugs, and should get COVID management drugs. The topic or the theme of this today's webinar, opportunities and challenges to pharmacy graduates in post-COVID scenario. That is an important topic. But I tell you, whatever the situation may be, pharmaceutical industry is always on rise. And once, whether it is pharmaceutical industry or API industry or medical device industry or cosmetic industry or diagnostic industry, there are a lot of opportunities for pharmacy graduates in all these sectors. And today's speakers, today's panelists, today's resource persons, Dr. Lokendra Sharma, Dr. Monica Jain, and Dr. Dheeraj Kohl, who are the expert in their field, they will be deliberating on various issues related to job opportunities for pharma students. And let us listen to them that how the future is. With these remarks, my special congratulations to Dr. Jaya Balan, the Principal and Director of Alvar Pharmacy College, for continuously taking steps in arranging these webinars for the pharmacy students. My best wishes to each and everyone. Thank you very much.
Thank you very much, sir. Thank you very much. And thanks for your motivation. And you started early in the morning and you are here with us to bless all of these programs. Thank you very much for your...
Most welcome.
And I would like to welcome Dr. Arun Gar to say a few words and inaugurate this session. General Secretary of IPGA, Dr. Arun Gar, please.
Good morning to all of you. Welcome from Indian Pharmacy Graduate Association. I welcome all the delegates who have joined in this cold winter, and especially the thanks to Professor Jay Balan for arranging such a beautiful program, opportunity for the Indian pharmacy graduate or graduates of the pharma and students post-COVID era. So COVID has seen so many things. Now the industry is also doing good, and we have so many drugs which are approved for treatment of COVID. And you have seen that the vaccines are doing very well. So there are a lot of abundant opportunities for the graduates for going into this pharmaceutical industry. What I would like to say to the students that they should have a very good communication skills. They also develop into the communication and personality skills, which are also needed in the pharmaceutical industry, whether you go to the clinical research or pharmacovigilance, or maybe to online pharmacy and other areas. So once again, I welcome all the delegates and request them, if they like the program, if they like the Indian Pharmacy Graduate Association, please join our association. We have our website, www.ipga.in. Thank you. Thank you, Jay Balan.
Thank you, Doctor. Thank you. Without taking much of the time, and we will move on to the speakers, invited panelists. Dr. Lokendra Sharma sir is there. Dr. Monica Jain ma'am is there. We start from Dr. Monica Jain so that ma'am can share her ideas on the topic that is allotted. Ma'am, please, can you share your views now?
उनको अनम्यूट करिए डॉक्टर साहब. डॉक्टर मोनिका, you have to unmute, please.
Yes, sir. Madam is given.
Dr. Jaybalan, she.
Yes, yes, sir. Madam is trying to actually her presentation is now
Okay.
received.
Okay, so very warm good morning to everybody. Are you able to see my screen, sir?
Yeah, we are seeing you actually. Your presentation is.
Are you able to see my screen?
Yeah, ma'am.
Just
yeah,
1 minute.
no.
It is coming. It is coming. Yes, yeah, it is there. It is there.
Okay, it's the coming. So thank you all for giving me this opportunity to present yourself. The topic which has been allotted for me is key skills and knowledge for pharmacists to play a effective role in healthcare system. So let us start with the introduction. We already know that you people are training the graduates in pharmacy, and pharmacist is a person who is prepared to formulate, dispense, provide clinical information on the drugs or medication to health professionals and patients. But hereby, I would like to just emphasize on the changing role of pharmacist, that is from compounder and dispensing chemist to drug therapy management, especially in this pandemic times of COVID. And hereby, I would also insist that the pharmaceutical care which is delivered by pharmacists seeks to optimize the patient outcome, and they have to provide an effective, rational, and safe use of medicine. And they have to be effective healthcare team workers, and they need to be skilled, and that is the main topic I'm going to touch upon. So when we talk about being skilled, you need to have the concept of 7-star pharmacist, which was given in WHO 2014. That is a caregiver, a decision maker, a communicator, a manager, a lifelong learner, and a teacher and a team leader. So these all roles are to be placed by the WHO, which is very much true in this COVID times. And important thing is the skills which are required, because my topic is concerned with the skills which are most important to be a pharmacist. The skill number 1 is accuracy, especially in types of COVID. You have to be very accurate in also reading the abnormal or so-called as doctor's handwriting, and you also need to be very accurate in putting the system information system in the computer, and you also measure the ingredients. Accuracy is essential, especially when new updated drugs are being coming up. Every now and then a new drug is entering for treatment of COVID. So first attribute or skill which needs to be addressed by a pharmacy person, a pharmacy graduate, is accuracy. Second is integrity. So often when the doctors are very much preoccupied, you need to check on the drug interaction, which doctors may forget, or the nurses are provided with the e-prescription and they may make a typographical error. So pharmacists becomes a proofreaders, and they have to have that confidence and integrity to stand up and ask questions to the relevant person so that no mistakes are being done at their part. Then they also need to have scientific aptitude. That is, they need to have an in-depth knowledge and enthusiasm, and they should be able to translate that knowledge, updated knowledge, complex information into simpler form and apply it to the patient care. Then we come to mathematical skills. This also is a skill which has to be developed by the pharmacy people and the pharmacy graduates. That is right from a simple calculation of how many pills a patient need to the essentials of making more accurate pharmaceutical calculations and providing the dosage form. Then they, at this time of COVID, especially I will insist on this particular skill which needs to be developed. That is the interpersonal skills for doctors and patients. To deal with this, they require the patience and diplomacy. And of course, with a lighter note, they have to reassure the patient. They have to soothe down the bruised egos and hurt feelings, which they have to play in COVID times. Then the next can be the advocacy. Now, this has been followed in areas like US, where a lot of advocacy is required between the patient and the insurance company. The insurance company, they often argue for the claims or the claims which is done by the patient for the medications which are not covered under insurance. So the pharmacy people should play a role in which they are more of the patient friendly attitude. Then management skill. They may be responsible for supervising technicians and dispensers, and so they may also be involved in managing budgets, monitoring inventories, and keeping the accountable records. So that is again a very important thing they need to follow. Then the multitasking skills. They are not only providing the required roles, but they are doing a multitasking goal. That is, they are dealing with the patients, they are ensuring the strict regulatory protocols, and they have to do this multitasking with 100% accuracy. Then the 10th skill which is required is diplomacy. That is, they're able to stay calm. They have to address the irritating doctor sometimes because of the preoccupation. So they have to stay calm. They have to bridge between a doctor and the patient. And also they have to ensure the safety of the patient, the staff, and other customers. So this is a very important skill which they needs to develop. Then they have to prioritize the skill. Suppose a waiting mother is there with a toddler, and newborn medication is to be procured, and a patient which is waiting for 10-20 minutes to get the medication. You have to prioritize which one to address first. Then analytical skills. They have to approach with their work with an analytical mind and to refer to the correct sources when necessary, as well as taking as logical and accountable approach to any decisions they regarding the patient medication. Then the next skill. These all are 20 skills they need to frame, like counseling skills. This is the most important part the pharmacy graduates should dwell upon, and they should develop inside them, because you have to explain the patient medication correctly, properly, and this is also related to the side effects. Sometimes the patient is so apprehensive that they start asking about whether it is a correct medication or whether what kind of adverse effects should be there. So at least the prime knowledge of the medications which is liable or which is accountable in times of COVID should also be having the knowledge by the pharmacy people. Then we have computer literacy, which is most important. Suppose I was not able to share my screen, or I would not be able to talk to you people, that I am a computer illiterate. So pharmacy cannot go without computer education. So computer literacy is one of the skill which needs to be developed, and it is already developed, I suppose. Financial acumen can be a process in countries like UK. The pharmacist may be responsible for budgets and ordering new stock, as well as controlling the other expenses such as salary. So they need to develop a strong organizational activity. Then we come to another skill, that is counseling. Counseling skill I have already covered. Then we need to develop the other skills like mentoring skills. They have to impart the instruction and pass the knowledge to the juniors. So of which various courses are also there, in which the mentoring courses can be taken up by the pharmacy graduates, so that they are able to develop the skill, that they can mentor their juniors using the experience and knowledge. Then they also expected to adhere to clear ethical and moral guidelines, regardless of their personal belief. For example, if a person has come for a abortifying pill or asked for a contraceptive pill, abortifying pill is being prescribed by the doctor, but for a contraceptive pills, they should not use their brain whether it should be a legal or not legal procedure. They have to just do what the doctor has said and without giving the much advice to the patient. Then they should also follow the ethics. That is, ethics, and under no circumstances should pharmacists disclose details of someone condition. They should uphold the right to have the privacy. This is very important because we are living in a closed community system, so any of the things should not be disclosed. They should possess the physical stamina, that they are most important people who work day and night, so they should have that physical stamina to deal with the excessive workload even during the COVID times. Now, the most important skill they need to develop is active listening. You have to be a good listener. You have to focus on the patient. You have to have a careful listening attitude. That is what is called as active listening. So that it is very dangerous if you lack that active skills, because you will be missing the important clues that will give rise to errors in the prescription dispensing. The top soft skill which needs to be developed in COVID era is communication, right communication, self motivation, leadership, responsibility, teamwork, problem solving, decisiveness, ability to work under pressure and time management, flexibility, negotiation, and conflict resolution. These are top soft skills which needs to be developed by the pharmacy graduates. With this note, I would also like to add upon that during this COVID times, what is happening is that here the doctors are ultra busy personalities and they are not accessible to the patients. So all these skills, which are soft skills, and which are 20 skills which I have already mentioned, should be inculcated in each pharmacy graduate, so they frame themselves into this situations of pandemic, become an effective team healthcare person, and add on to the value of taking the health care to the optimum, because this is what is needed. Patients are not able to access the doctors, so here come the prime role of pharmacist. So with this note, I am thankful to the organizer for giving me the opportunity to speak upon this very important topic and need of the hour. Previously also I have been in collaboration with Pharmacy College. I'm extremely thankful to Jay Balan sir and all the persons who are actually here, that is Dr. Anil Kumar, NASA, Dr. Arun Garg, Dr. Ajay Pathak, Dr. Rajkumar Yadav, Dr. Jay Balan, of course, all belonging to IPGA. Thank you so much. I hope this will be giving an insight to all the pharmacy graduates. Thank you for the opportunity. Thank you.
Thank you very much, ma'am. Actually, we were working for a long time with different topics. Today, it is very important. That is what every pharmacy college is striving hard to impart a quality pharmaceutical knowledge to all the students. And we want to re-emphasize from the speakers like you that what are the key skills and knowledge that is required for a pharmacist, especially in this condition like a pandemic and post-pandemic era. This is a very grateful, and we are grateful to you. Thank you very much, ma'am. And we have among us now Dr. Dheeraj Kaur, and without taking much of his time, we will move on to the next expert, Dr. Dheeraj Kaur, who is a geriatrician, nephrologist, and certified physician from USA. He's a New York based, and he has several data of his collection on this COVID and the COVID spread in US. Sir, we like to hear from you now. Dr. Dheeraj Kaur.
Morning, good evening to everybody. So thank you for this opportunity. Really appreciate what you're doing. And as you know, I have been involved in COVID-19 research as well as data mining for COVID for approximately now since it started January 2020. And I'm actively involved in teaching medical residents, students, nurse practitioners, and sometimes pharmacy students also around with us. So as you know, in US, pharmacy is a very different type of field, very different than India. There are specializations in pharmacy. There are many ventures which you can take. So just to give you an overall prospect, because I'm also connected with market. If you look at it, currently the pharmaceutical industry globally is equal to $1.27 trillion, T with a Tom. Just US, just in 2021, Big Pharma has made a profit of approximately 610 billion US dollars. 610 billion US dollar, Big Pharma in prescription drugs. That means medications which were documented, prescribed by physicians. Out of that 610 billion, the largest chunk of profit a single country has gained is US, which is 148 billion USD. Why am I telling you these numbers? Because this is just the tip of the iceberg. If you talk about the industry as whole, by 2030, 5x growth is anticipated. For example, if I give you just the numbers, last year in 2021, the biotech industry, not the entire pharma, just the biotech, which is the forefront of innovation, was equal to $129.14 billion in 2021, globally. I'm talking about global. And in 2022, it is anticipated to have a growth of 17% to $151 billion. So numbers speak everything for themselves. India, if you look at it, the current pharmaceutical industry in India, which plays a very important global role, especially when you talk about generic medications. India is the #1 country which when you talk about generic medications, good quality, low cost medications. Indian industry of pharmaceutical currently is valued around $41.7 billion. India is the third largest manufacturer of medications, #1 when you talk about generic. Now, why am I giving you all this data? This data is actually way more important for pharmacy students or people who are specializing in pharmacy after MBBS than for regular MBBS students or MD students or a regular guy. So what I understand in India, there are very good institutions like one of your institution which are preparing future of India in pharmaceutical industry. So once you finish pharmacy graduation, there are many fields which open up to you, including research and development of different medications. Specifically, if you talk about targeted medications, genomic gene therapies, gene editing, this is the new upcoming frontier which is opening up. It's a multi-billion-dollar industry. New jobs are being created. So anybody listening to me out there who's a student of bachelor's, I think you should take out from your mind that you will finish bachelor and start working if you really want to make big in life. Your focus currently should be at least do a master's degree. And I am giving you all the information for a global platform, mind you. I think the professor before me, she was very thorough, and I will touch some points as well. But I think she explained you very nicely for Indian prospects. Global prospects pharmacy student who graduates, the starting salary, if you talk, is between 70 to 90,000 USD per year, which probably converts to around 65 lakhs to 70 lakhs, depending on which institution you start, 60 lakh to 70 lakh range, right after you graduate your pharmacy. And after you do an internship, especially if you're doing with chemotherapy, or you're doing with pain management, or you're doing with CHF drugs, depending on where you are working. People after pharmacy, they can start working with an oncology team, they can work with ICU team, they can work with inpatient hospital setups, they can work with a big chain like CVS and Walmart pharmacy, which are very well regulated, or you can go with a pharmaceutical company and work there. But again, to start there, for an Indian graduate, it's must that you study very well, you have a master's degree at least, and then you can transit here. Now let's zoom out and talk to you about what is going on with COVID. So as you know, in the entire world, it is anticipated that around 70% of population to 85% of population of adults above 85 have been exposed to COVID. So why am I giving you these numbers? Because a lot of people, actually, you will see, who have gone through COVID, especially in India, have approached pharmacies for different medications, including antibiotics, so on and so forth, without a doctor's consultation. If you, as a pharmacy student or a pharmacy graduate, is sitting there, which is well equipped with this information, when you talk about information, like one of your professors mentioned, when you see a patient in a pharmacy here, as well as in India, because the medicine works the same way, you definitely should educate the patient about how to take the medication, what medications this drug can have an interaction. In an ideal world, in US setup, if you have a pharmacy, it has your entire medications listed. So if there is a drug-drug interaction, it will pop up. Before you can even get the medication, the system will tell you that if you are taking X medication and I'm starting you on Y, you may have worsening of nausea or your potassium may go up, for example, and what measures you should take. And that will send an alert to the physician as well, which we call integrated healthcare systems, which is the future in the world. Now, why am I telling you this? Because in India, it's a very common practice for a pharmacist not to be in the pharmacy and the medications are dispensed by some helpers, which is a very dangerous trend. And since I've been very closely attached with certain organizations and also in India, I can assure you, those days would be long gone when a pharmacy student or a graduate could work in 3 pharmacies at the same time. Those things would be a thing of past in next few years, the way central government is tightening up. So not only you should focus on one pharmacy at working, but you should also provide the standard of care to the patients who are coming. If I would urge you, if you are not able to understand the doctor's writing, please do call the doctor. Do not dispense the medication just by thinking. I have come to know about a lot of adverse reactions which patients had because the medication was wrongly dispensed. So the onus falls upon the doctor and the pharmacy student. So if you study very well in your school, you will understand, for example, hydroxychloroquine can cause a photosensitive rash. You can understand, you can educate the patient. If it is a summertime, if somebody is taking hydrochlorothiazide, even a diuretic, if you go in the sunlight, you can have a rash. If that happens, stay away, try to cover yourself. Very, very small, subtle things which patients can be educated. And the way healthcare systems is increasing, is improving, you will see, you will get paid for performance, and the performance will be patient outcomes. So you as a pharmacy student should very thoroughly study each and every medication. Do feel very proud of this education you are getting, because this is a very, very important subset of the end. It's a very important, essential subset of healthcare and medical delivery systems to the patient, because we as physicians can prescribe everything we want, but the net result will happen when the right medication will go in the patient at the right time. So we educate the patient, you also educate the patient, and the nurse has to administer in case the patient is at home. Always, as an educator, I educate my students, and I have given lectures to pharmacy students as well. Don't expect a patient would understand what is written on instruction of the medication. If an antibiotic has to be taken with food, do educate them. If the antibiotic has to be taken 1 hour later or half an hour later, do tell them. Do educate them not to miss the dose. This onus to some extent lies actually even more on the dispensing person, because like the professor rightly said earlier, the doctors in India are overwhelmed. India has one of the lowest doctor to patient ratio, as in for 15 to 1600 patients, there is one doctor. WHO asks us to have the ratio between 1 to 800 and 1 to 1000. So India has miles to go. So your contribution in outcomes will be very, very essential. That's point number 1. Point number 2, millions and millions of people have gone through COVID. India has a population of 1.488 billion people. 40 crore people are under age 18, close to that. Around 100 crore are above 18. Out of those 100 crore, at least 70% people, based on Sero survey, have gone through COVID. Now, what happened in COVID is a very different discussion. What I'm trying to tell you, out of those 70 crore people, most of them have approached pharmacy for getting an antibiotic without a prescription. Why that is a concern? You must understand, as a student of pharmacy, don't limit your education just to pharmacy. Do understand the disease to some extent, because your understanding level will go up. And I highly motivate you to feel proud of what you're doing, number one. Number two, this field will provide you so many opportunities if you keep your mind open and you are looking into international opportunities. Sky is the limit. Definitely in US, a well-educated pharmacy student who joins a biotech or a startup makes way more money than any other physician. So if finance is your focus, there are a lot of opportunities. I'm happy to talk about them later. But the point I'm trying to say is a lot of patients will come and ask you for antibiotics. The point is this: I have seen in India myself, a lot of pharmacy graduates start talking about which antibiotic to take or which not to take. Please don't get into that. If a patient asks you, I have sore throat, which antibiotic I should take, tell him to go to the physician. Do not yourself prescribe. Do not promote any medication. And please, if a generic medication does the same job, don't try to come under the influence of pharmaceutical reps and try to motivate a patient to take a non-generic 5 times more expensive brand drug. A lot of studies have shown there is no difference when it comes to efficacy of generic drug versus a branded drug. It's the advertising. So please stay away from that. India is still a developing country. If a patient is paying 70 rupees versus 700 rupees, that may be like 1 or 2 meals for his family. So that onus lies on you. You should be well educated, matter of fact. If somebody is sending you a brand name drug, you should also educate the patient. There is a generic drug available with equal efficacy. Do you want to check with your doctor? Try to save the money of the patient. That again, onus lies on you. I'm not trying to promote generic drug, but you must understand India is a role model. India is one of the best country when it comes to promoting generic drugs for developing nation and poor people in the entire planet. India makes the cheapest and good quality medications, cheapest and good quality vaccines, including COVID vaccine. Now, if you talk about 70 crore people who have gone through the COVID infection, even half of them must have approached pharmacy for getting different drugs. Now, why am I insisting this point? Because if you start giving azithromycin, like I saw in India, or augmentin to patients who are recovering from COVID, because once you have to understand, any viral infection when you have, it will affect your epithelium in the bronchus, will cause irritation. Even when you are getting better, residual cough will be there. You are not supposed to treat those patients with antibiotics. It goes on itself. If somebody is coughing too much, you can give them cough suppressants. You can also give them some kind of halls or ask them to take fluids, gargle their throat. That's it. It's symptomatic treatment. There is no need of antibiotics or antivirals when it comes to COVID, and that to mild COVID, which is getting better on itself, and that too for Omicron. It's very, very mild. Now, yes, if a doctor has prescribed an antibiotic for a COVID patient, that's a very different ball game. Unfortunately, during the second wave in India, a lot of antibiotics were wrongly prescribed to patients, which was not needed. The data was not out there, so I don't blame a lot of doctors, but currently everybody knows for COVID, there is no need of any hydroxychloroquine. There is no need of remdesivir. Specifically for remdesivir is good for certain very small window of patient. There is no need of broad spectrum antibiotics. Actually, it can do more harm than good. Why? Because your gut has a flora. If you give too much antibiotics, that flora dies. That flora is very important for your immune health, for your sleep, for vitamin B12 metabolism. It actually takes vitamin B12. So it does give you vitamin K. And it is very, very important, like I said, for your immune. And now studies are showing it actually prevents cancer if you have a good flora. It also prevents something which we call inflammatory bowel disease. It also prevents something which we call irritable bowel syndrome. And apparently, it decreases the incidence of depression and anxiety in patients. So if you have a good gut flora, your overall outcome is way better. So please don't kill it with unnecessary antibiotics. That's issue number one. Issue number two is, if you give antibiotics, it takes decades for people from our community and your community actually to discover the antibiotics. The antibiotics are working against the microorganism, bacteria, and the bacteria can learn how to fight the antibiotics if you are giving them like candies to everybody. Eventually, we have something which we call antibiotic resistance. For example, methicillin-resistant Staph aureus, for which now we give vancomycin. Now we have a vancomycin-resistant Staph aureus, so vancomycin-resistant enterococci. So now we have to give a bigger antibiotic. So at some point, the choices will narrow down and people will die. Unfortunately, India was the leading country in which we saw overuse of antibiotics. Issue number one. Issue number two, which we saw with COVID, was unnecessary use of steroids, like candy again. When you give steroids to people, it causes a lot of adverse effect. And I think you as a pharmacy student should know at least 10 to 20 adverse effects of steroids, which I will start counting now. If you give long-term steroid to anybody, it decreases your bone concentration of calcium. It causes osteopenia, osteoporosis. Your bones become weak. Number two, if you give steroids to anybody, it's a stress hormone like cortisol. If you give exogenous steroid, your blood sugars will go up, your blood pressure will go up, you will retain sodium. Anytime you retain sodium, you will retain water. So what will you see? A steroid, people who take steroids, they are swollen up. They have too much water in their body. Their blood pressure goes up, their sugar goes up. Number four, steroids can make somebody very irritated. And even to such an extent, they can go into something which we call steroid-induced psychosis, which is a real entity. People can have fights, they can be very jittery, and steroid can lead to insomnia. Number five. Number six, steroids can also lead to exogenous Cushing's, which is a very different entity. Steroids can also lead to your hair fall. You can have loss of hair, like a male pattern of hair loss. Steroids can also lead to skin thinning. Steroids can kill your immunity. Actually, believe it or not, for autoimmune diseases in which your immune system is the problem, is over-triggered. We give steroids to calm you down. Matter of fact, during COVID, there is a subset of people whose immune system not only fights COVID, it goes in an overdrive. Those are the patients we give short course of steroid. When I say short course of steroid, I mean steroids less than 3 weeks. What we saw in India and in many other countries, actually, unnecessary steroids were given and they were never stopped. People were taking steroid for months. Eventually, you saw increase in diabetes. If you're diabetic, your blood sugars will be very high, uncontrollable. Blood pressure going very high, somebody starting an extra blood pressure pill, person feeling swollen up. Why swelling up is a problem? Because if you have some degree of heart failure, that water will end up in the lungs. You can't breathe. Your oxygen requirement can start. So a patient who was a heart failure patient and he was okay in his diuretics and his medications, now you're giving him steroids, he starts retaining sodium and water. And what do you see? He can't lie flat. He's short of breath. You're giving him more diuretics, but again, the diuretics not going to work very well. On top of that, you will start seeing he will need oxygen because his lungs are full of water. He's too much water. He'll start gaining weight. So you have to be very, very careful with steroids. Another thing, steroid will bring down your immunity, like I said. So if your immunity goes down, what will happen? All the microorganisms around you, which are living in your skin, in your mouth, they will start growing. One of the common microorganisms which loves humidity is fungus, Candida. You will have Candida in the mouth, which we call oral thrush, Candida in the esophagus. You can also have different kind of skin infections. Matter of fact, if you have a sore or a cut in your body, which is about to heal, if you give steroids, the healing is lowered. The healing process of the skin goes down with steroid use. Another thing is you can get opportunistic infections like CMV, like Candida, and so on and so forth, which can again be provided, like mucormycosis, which we call black fungus. I'm sure a lot of you guys would have heard about mucormycosis, which India became the world leader of mucormycosis. Why? Again, unnecessary, we dispensed Too much steroid, number one. Number two, India is becoming the diabetic capital of the world because of lifestyle and genetics. So that was double whammy. So now, so why does it become important? Because you will be the person who's dispensing the medicine. So whenever you are seeing something is not making sense, don't hesitate to tell the patient and call the doctor. You can prevent somebody's health hazard. You can actually save a life. So if you as a pharmacy student think only doctors are saving lives, you are wrong. Matter of fact, the time we spend with patients is even 1/20th of what a nurse spends. What time I'm spending with a patient, probably you will be talking to him more in US, educating him about the medications. And patient develops relationship with his own pharmacist. When I say relationship, trust relationship. Don't exploit that trust relationship. Don't become a doctor for the patient. That's my very important take-home message for you guys. Now, another thing, as time goes by, you will see more and more telemedicine portals coming up. In US, there is a company, Teladoc. I am an analyst, so I have to go through those companies. It has done extremely well. The ticker is TDOC. We are anticipating the industry of telehealth will grow to 500 billion in next 5 years. And in the telemedicine subset, one of the areas which will be focused is medication dispensation. So understand this just for your introduction, because it's a very different lecture. I'm a physician. I have a patient who I'm talking to on Zoom. I'm going over all the vitals. I'm putting an order. Patient is going to the local lab. Lab test is done. I'm seeing on my, and then I'm ordering the medication, which is going to the local pharmacy of the patient. Drug-drug interaction is popped out. If I'm ordering something which doesn't make sense, it will alert two triggers, one to me and one to the pharmacist. Number two, pharmacist license will be held accountable as well. And this is globally happening. You can't stop it. This trend is starting. Secondly, when the patient comes to the pharmacist, there is drug-drug interaction listed on every medication you are dispensing. You have to chart the medication. I think with the central government, the way it's progressively acting, I think days are gone when you can give antibiotics like candy. It will be held accountable. It will be logged in the system that who's getting which medication, because you can have adverse effects, and adverse effects will be logged as well. So eventually you will see home delivery of medicine. A lot of companies will start doing it, which already in India is happening. For home delivery of medicine, again, you need a pharmacy person who's trained in pharmacy. So you really don't need to stand in a pharmacy to work. You can work from home, because you will have dispensing access on your fingertips, and you'll be approving. So that's one way to look at the entire pharmacy industry. Second way is there is so much work being happening in genomics. Anybody of you who has a master's in pharmacy and is happy to pursue a PhD and go in research, sky is the limit for you guys. Anybody who want to work in analytic work like I work, you have a PhD, you need to have a PhD. You need to have few years of experience. You can come and work for a startup, or you can work for a big bank as an analyst for a different pharmaceutical companies. Your starting salary would be 2-3 million USD or $500,000 USD, depending on where you start. Which is way more actually than any physician salary. So the point I'm trying to say is sky is the limit, provided you feel proud of what you're doing. Don't narrow your mind to the local areas which you are exposed to. Don't let people tell you that you are just a pharmacy guy, you're not a doctor. That's very wrong notion. It's an old dated notion. You need to know your material well. You need to study well, like your professors tell you. You actually need to study things which are coming new. Don't restrict yourself to the knowledge of the books. Currently, the era is of internet. There are so many online journals. I'm sure your professors will be happy to share that access. Correct me, professors, if I'm wrong, with you, which will enlighten you which venture is working. For example, if somebody wants to work on targeted chemotherapies for skin cancer or squamous cell carcinoma of the lungs, he wants to know which companies are working on which trial drugs. How do they work? I want to attach to this project. Each of those projects is 5 to 10 years. You can start with $100,000 salary if you have a master's degree. Obviously, you have to come here and do 1 year of crash course. But the point I'm trying to say is opportunities are huge. So when you think of you as a pharmacy graduate, do not think of yourself like a guy standing in a shop, small shop, and giving pharmaceutical medications to somebody. That is not the limit of things you can achieve in life. And maybe one day we can do a different on career counseling. But coming back to COVID, in COVID, there are so many people out of those 70 crore people who have gone through adult population, 100 crore, out of that 70% have been exposed to COVID based on the Zero survey. Out of them, even if 20% people had moderate to mild COVID symptoms, they are fair game for something which we call long COVID. Long COVID means after you have recovered from COVID and few months have gone by, you can still have joint pain, you can have headaches, you can have difficulty in breathing, you can have rash, you can have diarrhea, you can have depression. Why am I telling you this? Because these people will end up to pharmacies, to you guys, asking you for medications. Now, if you see anybody coming and complaining to you of chronic headaches, chronic joint pains, abdominal pains, diarrhea, rash, feeling low, and asking you medication, definitely don't give him the medication, but do ask him a question. Did you had COVID? If he says, yes, I had COVID, ask him, did you had these headaches before or it started after you recovered from COVID? If he says it after recovering from COVID, it should raise a red alert for you that this could be long COVID. Tell him to consult a physician. You can save lives because people can die from long COVID. It is very serious. I have seen many, many young people, including one of the anchors who actually invited me to his show. Very unfortunate, he died from long COVID. There are many other people who have lost their life or are not able to work at the same level at which they were working before COVID. So that's why we tell you, get fully vaccinated, mask up. It's not a good idea to go through Omicron because you don't know how much % of people going through Omicron will have long COVID. Long COVID is not dependent on whether you had mild, moderate, or severe COVID. Anybody who had mild, moderate, or severe COVID can have long COVID. I have seen people who had mild COVID, had long COVID. I have seen people who were in ICU or had severe COVID have no long COVID. So there is no correlation of severity of COVID and long COVID. So you have to keep your eyes and ears open. You will see millions of people because a huge population has gone through this. It will take months for them to realize, I don't feel myself right. And they will come to you. They will also go to their primary care physicians. But in India, as you know, for small things, people just go to the pharmacy directly. So it becomes your responsibility to educate yourself. What are COVID-related complications? Because this is the global pandemic. In the entire world, there is 7.8 billion people. India is 1.4 billion people. Out of those 100 crore people, which is 1 billion people, approximately 70% even adult people. Out of that, even 70% have gone through COVID. You will have huge numbers of people coming to the pharmacy in next few months. No government, no healthcare system can deal with it. It has to be a joint effort. So I highly, I'm happy to motivate you to know about what is long COVID. You will, I can guarantee you, you will see patients who have long COVID, but they would not know it is long COVID. People can have stroke, people can have an MI, people can have an insult. I have seen DVTs from long COVID. I have seen arterial clots in the legs, people losing their toenails and toes from this. I have seen a lot of cases of depression, anxiety, even suicide. I have seen pregnant women losing their children because of long COVID. It's a serious issue. So if you see any of these concerns, please bring it to your, tell them to go to the local physician. And I think a lot has been said, so I will be happy to answer any questions. Thank you, and I'll be another half an hour with you guys. So anybody has any questions, thank you.
Thank you, sir. Thank you. It's a long and descriptive talk, I think. Dr. Nasa is...
let me congratulate Dr. Dheeraj for nicely covering all the topics, all the important issues. You rightly started with, the image of pharmaceutical industry, And I'm very happy to listen from you that India is, manufacturing quality medicines since I'm a regulator. So this gives a lot of motivation to regulators. You rightly covered about, second wave, the misuse of remdesivir injection or SUQS tablets, side effects of steroids, which was a big challenge during the second pandemic, and about self-medication, antimicrobial resistance, which is a big, concern nowadays because antibiotics are, widely misused, I can say. A lot of antimicrobial resistance is developing. Data says it is a threat to the country, threat to the world. So antibiotics should be, used very judiciously whenever it is required. Particularly, during the viral infection, it is not required. And also, you have told you have covered about the role of pharmacist. I can simply say that pharmacist is a carbon-carbon double bond between physician and the patient. So he has to play a very important role. What medicines are to be dispensed, whenever any prescription medicines are required, so they have to dispense the medicine only on the prescription of a registered medical practitioners, like Schedule H medicines, Schedule H1 medicines, Schedule X medicines, like that. And apart from that, we have also covered about, various issues, future of pharmacists in the US, if they go for higher studies. So this is also an important, message to all pharmacy students who want to go for higher studies like PhD in pharmaceutical sciences or in relevant fields in US. That gives the, a lot of motivation to pharmaceutical students. Thank you. Thank you very much, Dr. Dheeraj, for your nice presentation. And we are highly obliged. Thank you very much.
Thank you so much. And, like Dr. Atul you have so rightly mentioned, see, for some reason, again, correct me if I'm wrong, I gave certain lectures in India when I was last time, and I do feel there is a lack of, self-pride in the students who are studying pharmacy. They feel that they're coming to pharmacy because they could not clear an MBBS entrance test or something else. I really want to tell you guys, you have picked an extremely smart profession. Once again, you can achieve the milestones which a doctor cannot. And I have colleagues which make 10 times more money than I do, who have done PhD in pharmacy. They are not doctors. And they are primary investigators. They are making like $10 to $20 million a year. So do not, please, I encourage you, don't think inside the box. Think outside the box. It's very unfortunate. Your box in India is very small. And I understand whatever background you're coming from, but don't limit yourself to the environment you are currently located. That environment is temporary. And with the things Government of India is changing, I'm telling you the onus and the answerability is coming. Restrictions on antibiotics is coming because this is a global concern. Resistance to antibiotics, antiviral, it's a global concern. A bacteria virus, as you have seen in COVID, does not care about intercontinental boundaries or inter-country issues. If a virus has developed resistance to the vaccine, which it has, Omicron, if you are double vaccinated, it's 31%. It's the same issue in America. It doesn't matter you are making 20 times less money or more. It doesn't matter which religion, caste, creed you are. We have a common enemy. And like Dr. Saab just mentioned, it's a double carbon bond. I totally agree with him. And I think people like him need to come out and upfront and motivate you guys. And please do self-motivation. I know it's very hard to do, but do self-motivation because a very bright future is waiting for you. But I request you again, do not take this field lightly. You need to work hard. If anybody is telling you pharmacy, diploma, or whatever you're doing, you will just get it and you will be happy. I'm sorry, the world is changing. People can go to jail for giving wrong medications to people. I know in India it has not happened, but I can assure you that is coming next. I'm assuring you that is coming next. I take my word for granted, write down date and time today. If you're a pharmacist, you did not double check the medications of a patient, you could be in trouble. If you're a pharmacist, you're prescribing medications to the patient yourself, not only legally you can be in trouble, morally you can be in trouble if you're causing hardship to somebody. So I highly encourage you, and that the issue starts lack of knowledge. Please do not study pharmacy for passing exams and getting a job. You should study it as a passion. Study it as a passion. Study it as a field where you will grow yourself, and you will see things will fall in place. The problem starts when you study to pass the exam. That's a wrong approach. Pharmacy is a very wide and a very beautiful science, very integrated. You need to know various subjects. And if you know it well, you can do very, very well. So please study each and every subject in your syllabus. Keep updated, read the new journals, ask your professors what are the latest things happening, attend international webinars. The current world is of Zoom. Nobody will stop you from attending a Harvard lecture if you register. Open your mind. And the world is flat currently. There is no boundaries for education. I just wanted to add that. Thank you, Dr. Atul, for seconding that.
Thank you. Most welcome. Thank you.
Thank you, Mr. President, and the speaker, expert, Dr. Dheeraj Kaul. And one more panelist is online, who is Dr. Lokendra Sharma. He is the backbone of all these arrangements, and he has introduced Dr. Dheeraj Kaul to me for making a seminar in Allur Pharmacy College. So I have requested Dr. Sharma to talk on pharmacist role on in the pharmacovigilance of COVID pharmacotherapeutics. He has corrected it as pharmacoprophylaxis. So chemoprophylaxis actually of COVID. Sir, you please give your inputs so that we can go for the next part.
Thank you very much for inviting me with a wonderful speaker, Dr. Monica Jain and Dr. Dheeraj Kaul. So I think a lot of discussion about this role of pharmacist in present situation, COVID, and so now we have some brief of some important aspect which we discuss, which is very well explained by Dr. Monica Jain and Dr. Dheeraj Kaul. One is in present situation, pharmacovigilance program of India, and pharmacists, they are very well involved in COVID situation for long COVID as well as COVID prophylaxis, as well as COVID management is there. So there's a lot of things in near futures, as this Dheeraj Kaul explained. There is a role of artificial intelligence in management of pharmacovigilance also. So basically, we try to understand that what our agenda is. We have to basically give emphasis on pharmacovigilance programs of India that is run by the government of India. And we also give some fixed approach on privatization of things, which we have to give priority. Then have some strategy on machine learning applications, as in some lecture Dr. Dheeraj very well explained. There are new avenues for pharmacy students. Then implementation of intelligent program. There is then in current future, current positions, what is the role of pharmacist in present situation and in near future. As very well explained by Dr. Monica, there is basically potential role of pharmacist during COVID pandemic. We have 4 different areas, we can say. Number 1 is role of community pharmacist, what they have doing. Second group of there is role of hospital pharmacist, they are involved in hospital management. And third group is the role of drug regulatory pharmacist. The pharmacist, they are involved in regulation of drugs. And the fourth group is role of industry pharmacist. So basically, pharmacist persons, they are silently working in 4 different areas. Like number 1 is role of community pharmacist. Community pharmacist managing disease educations, they are disease counseling. They are also educating, counseling about encouraging social distancing, also in using of face mask, also building. And this basically they also involved in utilization of misleading concept. They, as Dheeraj explained, this telepharmacy services, which is very well established in India. I have seen in my recent visit in NMC inspection, they developed very advanced telemedicine pharmacy services with collaboration with world different countries. All these countries, the telemedicine services they given, after their consultation, e-prescription is generated, and that e-prescription, e-dispenser is also there in machine, and that is whole free of cost providing. So this is very important as far as the present situation and in COVID scenario is concerned. This telepharmacy services, okay, then we have to require involvement of pharmacy student in active surveillance of COVID present situations. Then there is, we have to try to involve students and our pharmacy student also involving in vaccination program through role of pharmacist is also prevention of this COVID prevention also. Then pharmacy student all over India, they have all they are technical associated in pharmacovigilance centers. Government of India established pharmacovigilance centers. Every medical college, even every industry, they have their pharmacovigilance centers. The pharmacist student, they are important role in involving in vaccination programs and monitoring, chemoprophylaxis and therapeutic management. Then every hospital have their hospital pharmacist. They have involved in dispensing, they involved in pharmacovigilance, they involved in drug utilization, they also involved in distribution of PP kits. They also active member of clinical trial listing committee also. They also involved in development of clinical guidelines and treatment algorithm. They also important part of antimicrobial stewardship programs. So these are the important roles of hospital pharmacist. Another group that is disease and sterilization services. The hospital pharmacist also involved in disinfection sterilization program of hospital also. Then third one group, that is role of drug regulatory pharmacist. They are also involved in adequate drug supply management. They ensure good this good selling practice. They are administrative actions involved in, there is different quality testing also. They also important part in operational management also. So there's a third group, that is role of drug regulatory pharmacist. Then industry pharmacist, they are member of COVID management team and research and development also, either in vaccination program or their kit development or their diagnostic facility management. They also monitoring reporting of adverse event also. They have important involved in legal responsibility and legal requirement of management of drug development. So basically, we can say pharmacists, they involved in during pandemic, they have a role in as a community pharmacist, they have role in hospital pharmacist, they have a role in regulatory pharmacist, and they have involved in industry also. So we have to have collaborative common responsibility and opportunity and jointly working with to fight back in COVID in present situation, for fight for post COVID also. We have to fight for psychosocial support and provide different issues arise after COVID. And we also take part in involvement of pharmacovigilance programs. There is what the latest updation in machine learning and role of pharmacovigilance in COVID management, also pharmacovigilance in new opportunities. Lot of important thing which given or presented by Dr. Dheeraj Paul in various webinars. That is, we have to involve or we have to train our pharmacy student how we can work or how we can involve in present situations, either in post-COVID, either in vaccination programs, and recently digitalization of all healthcare system. So pharmacy students, they have to learn how this telemedicine services, e-dispensing services, and home delivery of drugs. So these are the new avenues arises for pharmacy students. We have to see how we can monitor patient safety, what are the challenges, what are the resource intensely involved, how we can improve compliance of these compliance in present situations of COVID management also. So this is lot of things. And we also have adverse we have to promote adverse event monitoring, adverse reporting also. This is very important as was present situation is concerned. Then recently there is a lot of new development in artificial intelligence, then robotic processing. So lot of automatic process either in of management of pharmacovigilance, either in management of COVID or vaccination programs. So we have to involve and motivate our students to learn new things, how this machine learning and deep learning and the different methodologies that help in management of COVID and this present situations. So I think this is all about aspect which have given me about role of pharmacovigilance in COVID situation on management and prophylaxis also. So this is very difficult situation. And now as Dheeraj mentioned that this we have to watch on long COVID also. So we have to watch long COVID. We have to watch or monitor vaccination program also. We have to watch AEFI, or that is vaccination induced adverse event also. We have to monitor and train our student for these all important things. So thank you very much. We basically recently have our all medical college. Recently we have get success in MOU with Manchester University and World Psychiatry Society for management of post-COVID, for psychosocial support and training our medical, pharmacy and paramedical students for fight against COVID and post-COVID and chronic COVID management. So let's hope we also involve pharmacy colleges of all over India and all over the, even we have involved all over the world for these different projects. Their projects are basically psychosocial support systems that is required and all new avenues that is developed in world level. And we also take regularly help of Dr. Dheeraj Paul for regular updation of our knowledge and our students. Thank you very much for inviting me and give me an opportunity with great speaker, Dr. Dheeraj and Dr. Monica. Thank you very much.
Thank you, sir.
Thank you, Dr. Lokendra, for your nice points and coverage. And particularly, I tell you the role of pharmacovigilance. It is very important, particularly for pharmacy students. Adverse drug reactions, that matters a lot. So drug-drug interaction, drug incompatibility, that we have to understand as a pharmacist. You have rightly covered. Now it is a time of artificial intelligence. Entire world is looking for artificial intelligence, and most of the pharmaceutical industry, they are using this artificial intelligence in drug discovery, in formulations development, in manufacturing, in research and development, in clinical trials, and so on. So it is a time of artificial intelligence. Vaccination program is also very important. Of course, COVID management. As a pharmacist, as a doctor, as a consumer, we have to understand how to go for COVID management. And definitely, like Dr. Dheeraj has covered about long COVID. This is again a big concern. So thank you very much, sir, for all your comments and nice presentation. Thank you very much. Dr.
Thank you, Dr. Dheeraj, for giving our new area. Basically, Government of India also created a digital program, digitalization of all healthcare system management, investigation also, drug interaction also, e-dispensing also, telemedicine, every aspect of new digital program of Government of India covered every aspect of this latest, whatever we think they have covered on this digital program, Government of India of healthcare system.
Yes, sir. Actually, when I was having a chat with Dr. Dheeraj, he was we heard about machine learning, but he was like a learning machine. He was asking so many questions, and he was trying to understand what is the existing situation in India and how the pharmacy education and all are progressing. So I was thinking like he is a learning machine. He is ready to learn, and he is ready to motivate people to progress. So this is a very great heart among with us. So I welcome Dr. Dheeraj once again to throw some light on NeoCo that is discussed in the social media for the past few days, 1 or 2 days, about the MERS mutated version of this respiratory virus. So can you throw some light on this, sir?
Yes. Hi. Thank you, Jalalji, Dr. Jalal, and Dr. Atul and Dr. Sharma. First, I would like to touch base once again. Learning never stops. The moment you come in science, if you stop learning, you're dead. So things have to flow. Every single day, when you get up as a student, think what you're going to read today for an hour. I think it should be your habit by now. If it is not, you will not be updated. Matter of fact, today I wrote a dispensing machine algorithm for cough syrups for children. So I do work with AI, artificial intelligence and machine learning in healthcare. One of the companies I'm working with, they have made vending machines and they're putting everywhere. So say you have an Apple iPhone. The moment your doctor sends you a prescription to the pharmacy, you will have an option with a barcode here. So you can go to the dispensing machine, show the barcode, it will say dispense, yes. The moment it dispenses, everywhere information will get Mr. XYZ got his antibiotic this date, this time. So your pharmacy will not dispense you again. Matter of fact, they are trying to integrate it with opioids like MS-Contin, OxyContin, morphine sulfate, short-acting, oxycodone. I'm a pain physician also, so we dispense it. So tracking down the medications is one of the key things which we are seeing. See, the next gold for everybody, all your students, is not gold anymore, it's data. The next 2 decades will be driven by data. The moment you integrate softwares with delivery systems, you are collecting the data back. Matter of fact, the moment you are coming to me and I'm giving you hydroxychloroquine or hydrochlorothiazide, hopefully I don't give you hydroxychloroquine because it really doesn't work for anything. But if I give you hydrochlorothiazide, which is still one of the initial drugs we use for hypertension, it works very beautifully. It's a very safe drug. But if you tell me you are a patient who had hyperkalemia in past, I will chart it. If you tell me you have a photosensitive rash, I will chart it. So the point is that information will get delivered everywhere. I'll give you a very, very small example, in next 2-3 minutes. You will understand the power of telemedicine, the power of integration of softwares in healthcare delivery system. So 4 years ago, when I was working at a different hospital, we looked into the numbers of patients coming to the emergency room. Out of those, how many are 65 years and above, older? In those patients who are coming to the emergency room above 65, how many of them are coming because of shortness of breath as primary complaint, like difficulty breathing? Out of those patients who are 65 years or old coming to the emergency room with shortness of breath, we further classified how many of these people have a diagnosis of congestive heart failure. Out of those, we further classified stage 1, 2, 3, 4, advanced. So what stage this person belongs? What we found out, approximately, say, out of 250 patients coming to my ER, say 30 patients are coming with congestive heart failure, out of them 10 patients or 15 patients above 65, and their primary complaint is shortness of breath. Because you can have age above 65, diagnosis of congestive heart failure, but don't have shortness of breath. You came with chest pain, or you came with cough, or you came with clot in the leg or rash, irrelevant. But the moment you come age 65, again, this is a software I'm showing you. Age 65, diagnosis of heart failure, classification, stage 2, 3, 4. Again, primary complaint, the reason you came to the ER is shortness of breath. So imagine that classification of patient. They come to the ER, we looked into what happens to most of these patients. We realized a subset of these patients, approximately 70% of these patients, will end up getting hospitalized. The moment you come to the emergency room, the cost of showing up in the ER is approximately $3,000 to $4,000 in US, depending on how many tests you're doing. Now, if I admit you to the hospital, that is another, each day is $2,000 to $3,000 plus medications. And if I admit you for one day, the odds that you will end up staying in the hospital for another day is around 70% likelihood. So what I'm trying to tell you is a patient who came with CHF exacerbation, with difficulty breathing above age 65, there is a very good chance if he goes to the ER, he will be admitted to the hospital. The moment an old person gets admitted to the hospital, does any student know what are you putting him at a risk of? I mean, I guess this is not an interaction, so I'll just tell you. So the moment an old person gets admitted to the hospital, your risks of fall in the hospital goes up, your risk of catching a hospital acquired infection goes up, like Clostridium difficile, pneumonia, anything. Nowadays, COVID basically. Another thing is something which we call hospital related delirium in geriatric patient group, that goes up. The point I'm trying to make is hospital is not a good place to be unless you really have to be there. So we looked into this data of these patients which were hospitalized, and we realized people who are coming in ER and getting discharged, not much is being done. They are just making sure no heart attack is there. But people who are being admitted, what are we doing? We are basically giving them diuretic. What is a diuretic? It makes you lose water. I hope everybody's with me so far. I'm trying to make it at a very low level so that anybody can understand what I'm saying. I hope that people are understanding. So this is real-time algorithm I'm telling you. I created it. So then we looked into, out of the people who were hospitalized, how many of them ended up in ICU? How many of them were in the wards? So out of the people who were in the wards, what did we do for them? So we did a CAT scan, which is a $2,000 thing. We did an X-ray, which is $200. CAT scan 2,000, X-ray $200. We unnecessarily gave them antibiotics, which again increases the risk of opportunistic infection and Clostridium difficile, which kills their gut flora. So another thing, what happens if you give antibiotics to somebody, you kill their gut flora and you increase the risk of Clostridium difficile infection. So we looked into these things, and what we realized, you won't believe it, for a hospital, a very big hospital like Albert Einstein School of Medicine, where I was working, we had approximately $150 million worth of people whose admission could have been avoided. How? If we manage their fluid well. That is the question. So it took us 3 to 4 months to dig deep, and we realized, yes, what are we doing for these people? We are giving them medications which are called diuretic. They are losing this water. They are feeling a little better in a day or two, and then we are discharging them home with little higher dose of diuretic. So the question I pose to myself, which is a null hypothesis, that what am I doing in the hospital which I cannot do before the patient shows up in the hospital? Because the moment patient is coming with shortness of breath to the hospital, I'm putting a strain on his heart. He can have a heart attack just from that volume overload and go through another associated problems if you're hospitalized. So what did we do? We created an algorithm. I advocated for that $150 million. Suppose we picked up an algorithm of 300 patients. Out of those 300 patients, 10%, 30 patients, we provided iPads. And that iPad was connected to a full length mirror. Every single day, patient after taking shower stands on the mirror. The mirror has a weighing machine, a weighing machine in front of a mirror. Weighing machine is connected by Bluetooth to the iPad, and the iPad is connected to the provider. So every day I'm seeing if his weight is going up. Weight by default for heart failure patient is sodium, which is indirectly water. So what we were doing, if the weight is increasing in a week by more than 2%, we were sending a nurse practitioner to patient's house and we were adjusting the diuretics. So this small intervention of monitoring, it costed us an iPad along with this around $800 of investment. But for that $800 of investment, out of those 30 people, 25 admissions were prevented. each admission is around $15,000. So an intervention of $800 prevented $15,000 on each patient. Multiply that by 300. You will see the numbers I'm talking about. Why did this happen? Because I integrated machine learning, AI, and algorithm platforms. So we are not only talking about money, we are also preventing the complications a patient will have going to the hospital, because it's not a good place to be. Number two, the disruption it causes to the loved ones and the family members. If your loved one is admitted to the hospital, you have to take days off from work and go there. That is again time lost from work. It's bad for economy. Number three, the psychosocial disruption, the mental stress it causes, that's very different thing. So small intervention like making sure his diuretics are adjusted, or we are cutting down his salt intake and monitoring it remotely, can save money, improve outcomes, decrease the chances of patient getting complications from hospital. It's so important, remote monitoring. Like I told you, the telehealth medicine industry in next 5 years will reach $500 billion. Be with the boy, $500 billion. So remote dispensing of medication is coming. You cannot stop it. You will see vending machines at different airports with barcodes. I have developed a software. I'm working on that for another company, but it's not that rocket science. So basically there will be a barcode. It will come on your phone. You go to the vending machine, show it, and it will dispense it will basically ask you for an ID along with this dispense, and then the record will go everywhere. So remote monitoring is coming, and you as a pharmacy student or a graduate would be an essential component of that entire chain. And that data will be provided back to the pharmaceutical company, which is making that drug, showing how good weight it is controlling, or how good, for example, for a brand of hydrochlorothiazide, how well it does for heart failure in stage 1, 2, 3, 4, in maintaining the weight, at what level the potassium goes up, what is the creatinine clearance or GFR at which I have to be cautious, so on and so forth. So data-driven, evidence-driven medicine is currently being practiced here, and that is the future. And you guys, like Dr. Saab earlier mentioned, I think he left, it's a double bond, C double bond. Is absolutely true. So you will have a lot of opportunities in the field. I'm very excited about that. And like Dr. Atul Nasa was talking about, again, India is one of the leaders in generic medications, good quality, low cost medications, #1 in the world when it comes to vaccine and targeted chemotherapy. I'm telling you again, next 5 years, a lot of investment is coming in India. Certain companies I know, they are looking into places like Uttar Pradesh and Madhya Pradesh. I know firsthand from the executive, and you will see a lot of development and a lot of job opportunities for you guys. But the key is you need to know your stuff. Nobody cares if you have a degree. If you don't know your stuff, it doesn't matter. People like me, people like others, we can figure out in how much water you are within 5 minutes by talking to you. And if you want competitive jobs, education, your qualification, degree helps, but how much do you know and how much passion do you carry? Are you keeping yourself limited to the box being provided, or you're thinking out of the box? So these are certain things which I really want people to think about. And like JLLG was talking about, I am happy to do a different talk on this, but I really want to motivate you guys and Mr. JLL, if you can organize a talk on long COVID, because each and every student will see long COVID, I can guarantee you. And even if 5% of those people are sent to the right person, a physician at the right time, they can save lives, they can improve their quality of life, and they can stop them from taking unnecessary NSAIDs. Do you know what one of the most common cause of kidney failure is non-steroid anti-inflammatory drugs taken without indication? And in India, and even in US, it kills. One of the biggest killer medication, if you talk about, is NSAIDs. So we have to control NSAIDs. We have to give other medications, and not everybody needs NSAIDs, and so on and so forth. There are many indications. But I, as a pain physician, I'm telling you, NSAIDs is overprescribed in the entire planet. So is opioids in US. But in India, I think it's underprescribed. So I just wanted to add that. And thank you again for this lovely opportunity to interact with students.
Thank you, Dr. Dheeraj, and particularly these opioids and NSAIDs, what you have rightly told. Now, this is also a big concern. So we would like to have one big presentation from your side on long COVID, and particularly the side effects of all these medicines like NSAIDs or opioids or steroids or other medicines which were widely used at the time of COVID. And we have seen right from beginning HCQS tablet, then remdesivir, then black fungus, amphotericin, then that medicine tocilizumab, widely all antibiotics, leading to so many side effects. So definitely I will talk to Jayabalan also, and we will be in touch with you to have one big seminar for 1 hour on any Saturday or Sunday as per your convenient time. So we can discuss in detail and let all the participating delegates from pharmaceutical industry, from quality control, from quality assurance, from different fields of pharmaceutical profession. And we can invite some other speakers also. Thank you very much.
I think that's a very good idea. And I think even medical students would really benefit from it.
Yes.
If we can integrate. Because again, long COVID specialized clinics are opening everywhere in the world. I think it's a matter of months before they open. I'm pretty sure every single big hospital in India will end up opening a clinic for long COVID. Very, very soon we will see. Secondly, the psychiatrist will have a lot of work in their hand, because it's very proven that depression, anxiety is at a sky-high limit right now. People are recovering from COVID. People have lost jobs, financial issues and challenges. And you cannot do your optimally well if you are going through depression. And subclinical depression, undiagnosed depression in US is around 25%. In India, I can guarantee you it's even way more, because mental health is a real concern there. So I think these certain areas which we can definitely focus. And like you rightly mentioned, because I've been involved with COVID awareness in India a lot. I've done more than 500 interviews. And if you look me up in most of the channels, some of them, they actually upload with my name, some don't, so you can't find most of them, but some you can. But I can guarantee you the use of synthetic cocktail antibodies in India was wrongly used, which was given to people after 5 days. There is no indication. It doesn't do anything. Remdesivir, if you do it at a wrong time, it's a waste of money. So the problem in India is not an insurance-driven company, healthcare infra. People have to pay from pocket. I know people, I used to have hundreds of calls every day. I literally had to give, I have a separate cell number. I used to give it to people and they would call me and I would consult them. And I can guarantee you 9 out of 10 people were wrongly given remdesivir. 9 out of 10 people who don't need steroids were given steroid. At least 5 people out of 10 were given steroids for way longer time than it is needed. 7 out of 10 people, I have all this data, were given unnecessary antibiotics and synthetic cocktail. Every single person who has money going to the hospital is given synthetic cocktail. There is no indication. There is no need. It's a waste of money. Unfortunately, people are paying from pocket. It was like a lakh something. Correct me if I'm wrong. Maybe later it became cheaper. I'm talking about cases in Delhi. It was not needed. And I have done so many on the media awareness, but unfortunately, I think MBBS and MD students did not have time to read journals. So later on, Government of India actually made it mandate or something. Every 2 weeks, you have to be on a webinar to learn latest things, which is a very good step. But the point I'm trying to make is right information at right time will save lives, will be very cost effective, and will lead to satisfaction and gratification for the provider as well, and improve outcomes for the patient and improve patient-doctor, patient-pharmacist relationships, which is very key. As you know, placebo effect is 30%. If I give you a sugar candy and if you trust me, 30% odds that it will work. So the trust is a key factor. And every single pharmacist sitting here, I highly encourage you to feel proud of what you're doing. You should not think once again that you're in pharmacy because it's a second choice. No, you are in the field, which is very much needed. It's the highest growth subsector in next 10 years. I'm repeating myself. It's the highest growth subsector in 10 years. With AI algorithms coming in, the primary care physician will have a really hard time dealing with issues. Most likely, as insurance will pick up, you will see in India, there will be software. Telehealth will replace it, and gone are the days of MBBS doctor. So, either you are specialized in something, you are operating, you're doing procedures, you have to specialize, and you as a pharmacy are already specialized in the field. So I am very optimistic for your future. And like Dr. Atul said, I'm happy to do a seminar on long COVID. I think it would be very nice if a panel can come. We can invite people from medical college or whoever wants to come, because it is the next challenge for every single healthcare infrastructure in the world, every single, including US, and especially countries which have financial challenges. It could be very, very draining if people unnecessarily go to doctors or don't go to doctors. Regardless, the outcomes would be bad. We need to utilize our healthcare resources very judicially and have the best outcomes. So data-driven and science-driven interventions is what we should focus. Again, AI is coming to healthcare, and that's where it will make a very big change. So I just wanted to add that, but thank you so much.
Thank you, sir. Thank you for your nice insights. And now we open the session for questions, and allow participants to unmute. So participants, if you want to ask any questions, please you may ask by raising your hands. And we have among us one of the young and active person from Rajasthan. Bharat Vasishta is there. He's he's very well involved with the. So do you have any questions, Dr. Bharat?
Very good morning, sir.
Good morning. Good morning. Yeah, please proceed with your question.
Sir. First of all, thank you for organizing such a very good webinar. I mean, this is the need of today's. I mean to say the things we are suffering from last 3 years. No? The pandemic, COVID is there. COVID is there. So very rightly said, Dr. Dheeraj, we pharmacists should come forward and take opportunities which are there. Number of opportunities are there, and the students who are here to attending this webinar, they should come to know that what actually they are for in pharmacy, what they have to improve in their self to serve community, to our society, to our nation. And as the person like Dr. Dheeraj is there, and if he is continuously with us, as Dr. Nasa has proposed a very good proposal that we are very frequently invite him for good seminars and lectures. So such type of insight of the actualities, what actuality is there and required for us. I mean to say very fruitful for the neonate pharmacist. It will be there. So I think the session was quite good, and I think this will work to our pharmacist. Thank you, sir.
Thank you, Bharat. And we have one senior Indian Pharmacy Graduates Association member, Shri Binod Kumar ji from Bihar. Sir, if you want to add on some points, we'll hear from you. Be allowed to.
Hello.
Yes, sir.
Good morning, sir. Everybody, good morning. I'm listening to a program for last 1 hour, and a very nice program going on. Dr. Chaudhary and so many speakers told a lot of things. Very good thing. I want to say one thing. The entry of the pharmacist should be in each and every ward of the hospital. Introduce it. Pharmacist must be in each and every ward of the hospital, in government and private both. Because if you don't come in touch of the patient, if you don't see the prescription of the patients, if you don't watch the patients after taking the drugs, then you cannot have the notice, ADR and all the reactions. So each and every ward must have a pharmacist. It should be raised. Number two, it's very good thing this type of webinar should be organized. There are so many persons, so many institutions they discourage our pharmacists that no scope, no future, nothing like that. You, the persons, thank you very much that raising all these things, and the moral of our pharmacists must be kept high. It's our responsibility, and you, the fellow, are doing that. Thank you very much for that. That's all. Okay.
Thank you very much, sir. Thank you. And I think there is no questions. One in the chat box that about the paracetamol, Dolo 650. Some students have raised some questions. The overuse of Dolo 650 in India. So we just want Dr. Dheeraj to clarify what will be.
Yeah, that's a good question. Actually, we actually do like paracetamol. It's a very safe medicine. Even if you are a cirrhotic patient, as in your liver is failed, we can easily give you 2 to 3.5 grams of paracetamol per day. 2 grams is very safe. It has least side effects, but again, it's not a toffee. It's not a candy or multivitamin. It should be given for indication. Matter of fact, I would highly encourage students to understand the concept of fever. One of the most common indication of paracetamol is fever, but you need to see again, Mr. Jialal, excuse me if I'm trying to push your students, but you understand when a disease comes, my friend, it doesn't look at your degree. Nobody cares. COVID will not gonna care you are a pharmacist or an MD or a PhD. It doesn't matter. It's a virus. Same thing. Your body is very ingenious machine. The moment an uninvited guest will come to your house, it increases the temperature. It increases the thermostat. Why? Because it wants you to be unwelcomed. It's like somebody come in your house and you pulling out the couch, you're throwing water on the floor so that he leaves. Something like that body does. And it increases the thermoregulator center is in the brain. It works and it shivers. You know what shivering does? It increases heat. When the heat increases, your fever goes up. The fever is your friend. It's trying to deviate the virus or the bacteria to leave. But what do? The moment you have 101, we kill the fever. It's a very bad practice. That is one of the most common indication why paracetamol is used in India and in US. So again, do not advise people to take paracetamol for a mild fever. Not a good idea. Next thing, when you have fever, you have interleukins. Interleukins can cause body aches, little bit of arthralgias. What do you need to do when you have? First of all, let the fever come in. If the interleukins are causing arthralgia, interleukin 1, interleukin 6, IL-3, I can talk, that's a very different webinar. But anyway, one of them causes you to have high temperature. That temperature is your friend. But if you have joint pains, what do you need to do? Your kidney can flush the interleukins. Just take too much water, honey, lemon tea, herbal things, water, fluid, soup. It will go away. Don't need to take paracetamol. Why do you want to? See, the other thing is paracetamol, when you take for a long time, it can buff up your liver mechanism of P450 and other enzymes. It can interact. So what will happen? The metabolism of a drug can go up or down. So the concentration of the drug will change in your body if you chronically take paracetamol or even certain other medications, which can change the metabolism of certain drugs. So once again, paracetamol is a very good drug. If you have chronic arthralgias, chronic arthritis, I prefer it over NSAIDs because NSAIDs, like I said, is one of the most common cause of kidney failure, number one, globally. One of the most common causes, as you know, is diabetes and hypertension. And diabetes is the fastest growing disease in the world. India is becoming the diabetic capital of the world. Very different topic. But if you take NSAID, the other problem NSAID does is you have a layer in your stomach and you have acid. That mucus layer your stomach is having to protect the acid getting in touch to your stomach lining is destroyed the moment you start taking NSAID or steroid because it needs prostaglandin. So if you take NSAIDs or steroids, the prostaglandin goes down, the mucus barrier goes down, and you will have gastritis. And if you don't manage it well, you can have erosion, corrosion, and eventually develop gastric ulcer, which can bleed. And if you don't treat gastric ulcer, as all of us know, a small fraction can go into gastric cancer. So it's not a simple thing to start taking NSAID. Can somebody tell you that if you take 10 grams of NSAID, you can have kidney failure, or if you take 1 gram of NSAID, you will not have kidney failure? No, nobody can tell you. I have seen patients who are developing renal insufficiency or renal injury from just taking 1 gram of NSAID for 5 days. And I have seen people doing well with 4 grams per day for months. So again, it depends people to people. And you should understand, kidney, you have 2 kidneys, many millions of nephrons. So if I take out one kidney can take hypertrophy and it can work. You would not see any changes in your blood, even if 20% of one kidney is gone. The moment 30% plus of one kidney, if you have only one kidney, starts getting damaged, you will see the GFR will drop and creatinine will start rising. So a lot of times, a damage to your kidney is done by NSAID, but it's not showing in the blood work. Your reserve of nephron gets damaged. And as you age, 1% kidney function drops. So the point I'm trying to say, paracetamol is a way safer drug, but like any medication, it has its own adverse effects, but it is safer than NSAIDs. So I hope that answers the question.
Yeah, I thank Mohammad Azhar Ahmad for this question. And is there any question from the audience so that we have taken a long time for Dr. Dheeraj. He is crossing midnight, I think. So this is not fair from our side to take much of his time in the midnight. So,
yeah, you know, one of my passion is teaching. So as you can see, I can stay up. It's 12:27 a.m. Basically, like you said, 27 minutes past midnight. But I'm happy to answer any students if they have any questions or anybody.
Thank you, sir. Thank you very much for your passion. And I think there is no question from.
Sir,
yeah,
I have a question.
Yeah, please.
Good morning. Good morning, sir.
Please introduce yourself and ask.
Myself, Rajnikant. I am from 8th semester student of Pharmacy College. And sir, I am also a SAS-based certified. Dheeraj sir, can you please suggest me how can I find my career abroad outside from India?
No, so I'm sorry, I didn't get the. You have graduated or you are an undergrad student?
I'm an undergraduate student, sir. I am in final semester of BPharm.
Okay, so let's take you as an example. Okay, I hope that is okay for everybody else listening. So, have you looked into which field you want to go into?
I'm looking for a research analyst job, sir. You are also an analyst,
right? So basically, I would highly encourage you to do a master's. If it is to me, I will abolish bachelors of pharmacy in India. I will make a combined 5 to 6 years master's degree after high school. There's no need of bachelors of pharmacy because things are evolving way fast. So nobody's going to take you seriously if you don't have a master's degree. Let's start with that. That's the number one thing I would do. I would get into master's degree program, but that is just degree. At the same time, I would educate myself at global level if you are looking for those kind of jobs. Once you are done with the master's, I would look into doing a PhD abroad in US, UK, Canada, Australia, New Zealand, wherever you want to do, or India. But I would do a PhD under a world-renowned mentor under the field of medications which you like. Suppose you want to work in chemotherapy area, then you find, and chemotherapy is like, you know, with each and every organ, with each and every cancer, there are different drugs going. Suppose you want to work for research on, squamous cell cancer of the lung, or you want to work for melanoma, or you want to work for gastric cancer, or colon cancer, or adenocarcinoma. So then you will look into world-renowned people in adenocarcinoma of the gut, of the colon, or squamous cell carcinoma of the colon, or adenocarcinoma of the stomach. Who is world-renowned? How will you know who is world-renowned? Again, it comes back to the same thing again. You have to read the journals. So if you read the journals, you will know who's working on which research. And then secondly, I would encourage you to go to seminars of pharmaceutical companies when they're coming up with new drugs. If you physically cannot go, register for webinars. You can attend. They like people like you, and do apply for scholarships for PhD program. But I highly encourage you to finish your master's in India. If you can do it in overseas, it's good, but at least have a master's degree. And then once you finish PhD in pharmaceutical, then you can attach yourself as an analyst, as a junior analyst, and you can work for a company for a couple of years, 4, 5, 6 years, and then they can hire you as an analyst. And once you are an analyst, then you can grow up whichever field you want to go. That becomes very finance oriented. Then you may have to do an MBA at some point after the PhD. But PhD is your ticket to that industry. They will not give you any serious job unless you have a PhD. And like I said, every single student of pharmacy listening to me, start making up plans for masters in pharmacology, wherever you want to do. That's my message to you.
Thank you, sir.
Thank you, sir.
Asmit Raj, you raised your hand. Please unmute and ask question. Make it fast, please.
Thank you, sir, for giving me an opportunity. My question is also from Dr. Dheeraj. And is there any medicine like Ayurvedic and Siddha or Ayurvedic system?
I'm sorry, I can't hear the question. Can you repeat
Sir,
your
is
question?
there any medicine like paracetamol in Ayurvedic or Siddha system?
Okay, so I'm not an Ayurvedic doctor, so I cannot comment on that. Maybe somebody else can take that question.
Yeah, actually, this is not the question suitable to this platform. And if you want to learn more from Ayurvedic side or any drug that is equivalent to paracetamol in this another traditional system of medicine, you can come to us and we'll have a discussion in our college. We can call the people who are from Ayurvedic, Yoga, Unani, Naturopathy side. They can very well explain you what is the drug that is equivalent to paracetamol and that can be given to you for treating your fever now. So we'll discuss it later, Asmit. You can mute yourself. Sir, is there any other question so that we can move on to the next part of this session?
Yeah, Balan,
Shall we move?
I think now it is a long time.
Yes,
let
sir.
Let us come to the end now.
Yes, sir. Yes, sir. We will move on. We will move on to the end, and I am moving to it. And this is the abstract of today's event. That there are 3 addresses given by invited expert panelists. First, Dr. Monica Jain has given the talk on key skills and knowledge for pharmacists to play their role in healthcare team effectively. And Dr. Cole has taken the full webinar on his own, and he has delivered the talk on opportunities and challenges to Indian pharmacy graduates in post-COVID scenario. And he has introduced this long COVID also, and we will have another session in the near future with the support of IPGA. And the Dr. Lokendra Sharma, who has given a nice input on the pharmacist's role in the pharmacovigilance of COVID chemotherapeutics and prophylaxis. So with these 3 talks, we are moving on to the next part of this webinar. So with a word of thanks, I would like to thank, first of all, IPGA for giving me this opportunity to organize this webinar in the platform of IPGA. So thank you very much, Mr. President, Dr. Punasa, the General Secretary, Dr. Arun Garg, and all other IPGA members. Next, I would like to thank my management of Allur Pharmacy College, who have given me all the support to use all the facilities of Allur. And then, without taking much time, I would like to thank all of you for being with us in this morning of a very chilled Saturday. Thank you all for being with us and giving the opportunity. I thank my Rajasthan IPGA team and Alwar local chapter team for giving all the support in this organization. So thank you very much. Please, I request all of you to raise for a national anthem.
पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्च चञ्चल जलधितरङ्गा तव शुभ नामे जागे तव शुभ आशीष मागे गाहे तव जय गाथा जनगण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे.
Thank you, all of you. Thank you very much for attending this. And with the permission of the chair and the speaker, I would like to end up the session. Thank you, Dr. Dheeraj Kaul, once again. Thank you, Dr. Azithromycin sir.